Yeah, hi. My name is Regina Emmanuel. I'm here to discuss about the telehealth and telecommunication. That is my final project, class project. And I'm here to tell you what telehealth means, what telehealth means, and telecommunication. Telemedication, I'm sorry. Telemedication is use of medical interchange from one area to another through electronic communication supplies the patient's health condition. The communication include video conferencing, transmission of the still image. It moves healthcare delivery from the hospital, from the doctor's office into the patient's own home, which is really comfortable or really good for especially disability patients and elderly people, especially those that are in New York who are not mobile, that depend on public transport. So it's very difficult for them to travel that far, and also is better access to specialist care, and it does not include continued medical education, which is according to the research I found. And tele is used mostly for, to me, I think is very play a very good role during this pandemic outbreak, that really help to protect patients from exposing to COVID-19, and also the patient, you also reduce the amount of call, no show of patient. They never keep the appointment, it's a non-compliant. They may not be non-compliant, but due to the situation beyond their control, they will not be able to come. I see the telemedicine and the telehealth informatic in a healthcare organization is focused on the handicapped, elderly, blind, hard of hearing, those people, heavy pregnant women, running up and down tired. So it helped them, yeah, and also that helped to suppress the stress the patient feel when, especially the stress of coming to the hospital, spend the clinic, spend there for hours, spend there for uh, so many minutes, and nobody have called them. It's very frustrating. I work in a clinic. I know how many times apology goes out, and the importance of telehealth. The healthcare professional use the video conferencing to improve, to provide virtual assessments to treat patients, also communicate with other healthcare providers. Telemeds and the home care nurses rely on those technology. It really help a lot, you know. It really help a lot for the healthcare. Instead of going to the patient home, a lot of people, like when I was doing when I started in this, I was doing not home health aid. I hate it, and even I hate it. Going to patient homes sometimes, some are nice, some are not nice. Trust me. So it cut off all those things, and it will make more visiting nurses to love their job more, because you're not going there every day. At least you can see your patient. uh You can see your patient very well. I'm only trying to give some of the sample of this my project, but I'm not going to discuss everything because I'm still doing my project. But I just want to say what I am writing, and how to protect patient from unnecessary traveling and frustration, long waiting in a doctor's office. And what is the role of a nurse in a telemed? Healthcare is increasing, driven by information consequently, frequently, and the way in which the healthcare is going now. The nursing informatic use information technology to improve the patient care. process and the healthcare. What I'm saying now, if any nurse do not know about technology, it will be very difficult to be able to work in a healthcare now, because the healthcare is going in a different dimension, like greater than the Florence Nightingale time, and it helps safety. You know, this telemedicine, it helps safety. It help to promote safety in times of epidemic and epidemic or pandemic. You see, so a patient will not be exposed. Those who have immune suppression difficulty, they will not be able to be among those who have infection or all those things. So you help them a lot. And how can healthcare services telehealth use during the COVID? It was used to facilitate public health, protection and strategy through the pandemic. It helped a lot. So what I am saying here is the way the healthcare is going now. It's going sometime now. Is going because we don't know. Nobody knew that tomorrow, like COVID-19 would have take place. Nobody. So every day is coming out with different thing, and it making nursing field now more difficult. So only the strong shall survive. And I'm trying to discuss about the telehealth, telehealth. Telehealth is use of electronic information and telecommunication technology to support long distance clinical health care, health administration, public health, professional, and health related education. It delivers services via through internet, telephone, streaming, video conferencing, wireless connection, and it focus support electronic record, electronic payment, management information. I've started working in a different department in a clinic now, and we are less printing appointment sheet. We only encourage the patient to download the apple. When you download the apple, so all your information will just immediately you download the apple, you get your password. So whatever information you need to find, you go to your phone, you will get the phone. We are no longer printing out, oh, the appointment time, lab test, this, that. You don't know, it's not no longer. But this technology, informatic, and the EHSR thing with this class we are studying, it will mostly help those who are those who can read and write, but it cannot help those who cannot read and write. It will be difficult. So we will still print out appointment. We will still print out appointment paper, appointment sheet to give to them for the reminder. But those who can read and write, you go to your phone, you got it. If you can't read and write, we print it out. Does it mean that you cannot take care of them? You will still take care of them. If they don't read and write, it doesn't matter. They must be taken care of. You understand? So this is also it helped reduce the stress of the patient. So now patient is totally involved in their care, because you have everything. You not calling, oh, I did a test the other day, I have not got, but immediately the result come, you get your test. Oh, I forget my appointment. Immediately you have the appointment, you will get it on your phone, except you are not paying attention. The patient is not paying attention. Will some of them not come? Yes, some of them will still not come. Okay, that's what I can do for now until I finish my project. Thank you very much. Bye.